This video is specifically for the families of children with cerebral palsy who are experiencing the need for tube feeding. So tube feeding nowadays is a relatively routine procedure with tens of thousands of kids with cerebral palsy getting those. Now, the main discussion usually goes in the dimension of which nutrition to take, formula, natural one, how to handle the formation of the gases, and so on. But the part which really receives very little attention is related to scarring and the rehabilitation after the scarring. So this video has this particular focus on it, because if I just put here something like scarring, well, tube feeding can cause scarring, primarily in the form of granulation tissue, and you can see really not much is going on about it, but in fact that's a huge issue. And why? Because the scarring itself covers multiple layers. It penetrates through the layers, and when the healing is taking place, spontaneously it's just fused. So therefore, that loss of the division between the layers translates into a whole bunch of the additional troubles. The first trouble, of course, being with the way how it affects respiration. The second trouble is that the fusion might cause the additional challenges with the scoliosis and the poor development of the abdominal compartments as such. And the third aspect would be the way how it affects the development of the legs. So these are just main points, and in this video we are showing the effects of how the ABR package of addressing the scars with the ABR fascia gel and the micro vibration devices actually brings remarkable transformations to the child who is tube fed, and then brings a cascade of the additional positives in the way how the affected components of breathing, abdominal development, and then further down the actual positioning and the comfort of the legs work as well. So here we are. This is a kid from Norway. He's actually, we are comparing the periods which are 2 years apart, and for 2 years apart, here we have the 2023, so that's November 2023 on the left, and we have the November 2025 on the right. So this is a kid who is now 18 plus, so his general growth has been more or less completed. So therefore what you see as this rather significant changes in the way how his entire torso look like. And now we're going to have a closer look at the way how everything works in terms of mobility. So those ones are not just a spontaneous growth, these are really the products of the work that has been done deliberately by his parents and the caregiver. So have a look at this. What you're seeing? You're seeing that the respiratory mechanisms are very different. So the way how the ribs are being engaged on both occasions and the abdominal wall, they are completely different between the before and after. And if I look then closer, we're going to see this difference even more remarkably. What happens in the before video, right? You see, when he does the breathing, this deep glued scarring between the layers, which are actually feeling also very flat here. So what do they bring? They bring the kind of tightening of the abdomen inwards. And respectively, with the tightening of the abdomen inwards, you see that this scarring itself also drags the ribs with it. And we're going to study it better afterwards, so to understand what's going on. But here you can see the new one, the new video shows you what? Shows you considerable room for the expansion of the ribs. See, here it's the closure of the rib, and that's a kind of sideways shuffle ribs. Here you can see how it's shuffled sideways, contributing additionally to the scoliosis. And of course, if we draw the line, you see here is one point, another point, right? So you see, and if I draw the line, that will be the thing. Yeah, so that's a contrast that we have here. Now, if we track the line of the lower ribs, it would be here, and then if I draw the line, that's what you see. So the contrast between the two is really much reduced. So you see the whole balancing act of the respiration is significantly better. But then what you also see here, if you look at it closer and we zoom in, we're going to see what's behind this result. Behind this result is a radical change of the scar. You see, this scar is tight. See, this scar is restricting the mobility of the abdominal wall. And you also see that, of course, the position of the entire peg button is, we'll see it a bit later, but it's really sitting across the longitudinal abdominal muscles and then creating this significant conflicts. Whilst in the new video, we can see that this is much relaxed abdominal appearance. So that is something very, very important that I want to share, and that to make sure that you really understand this very well, that these parts of your interpretation, that it's not just the feeding itself which needs to be taken care of in the tube feeding process, but that in fact, even if it brings benefits of nutrition, but what unfortunately doesn't come into a standard package of the post-tube insertion rehabilitation is that nobody really takes care of the scarring, because this scarring process has multiple years. He's been tube fed for years. So, and he actually grew through his puberty with this tube feeding insertion. And you can only imagine how this kind of tightened knot has been contributing to the deformation of the development of the torso throughout this period of time, because as you can see, it affects the way how the mechanics of respiration are working, right? And the mechanics of respiration, what's the key thing that we know about the mechanics of respiration? That it works 20,000 times a day, right? So you see 20,000 times a day you're having this small distortion taking place. And vice versa, if we are rebuilding things, so then we have the opportunity to get them into the much improved state, where the activation of the ribs as such and the work of the mechanics of the respiration in a much more balanced way helps the development of the child. So that's a first simple idea. So, and in that sense, that's in this part one, that's a demonstration how the tube feeding is not just tube feeding, but also the relationship between the layers. And to get it even clear, let's look at some diagrams of the abdominal muscles and their relationship with the chest so that you understand it better. So in fact, this picture shows it very well. So what you have and what you really need to learn about the abdominal wall. The abdominal wall itself has multiple layers. So here they are shown, and you can see they have 4 different orientations. So where the most superficial layer, that will be the layer number 1, it has the vertical layout. The deepest layer number 4, and that's what we actually really need to reach, has a horizontal layout. This one, the ascending internal oblique, so that's the layer number 3, it aims diagonally upwards, and the external oblique, so external oblique itself, so these are the layers which are descending from the top, so that's the layer number 2, and that goes diagonally downwards. So what's the problem with the scar? The scar, once it's placed here, it actually pierces through and fuses everything together. So, and that's really something that you need to take very, very seriously, because it goes through all the layers. And these layers, you see, that's another demonstration that shows you, well, it's not one layer, it's not even 4 layers, but if you start looking at all the other ones, it's, good 12 layers that could be identified there. And now we take the scar in, and that scar literally fuses all of them together. But what's the main problem with this fusion? Now you only have one direction. You don't have 4 directions. You only have one direction, which is usually just a vertical one associated with the most superficial layers. So then your child loses their essential other dimensions. So you see the muscles which are aimed diagonally downwards, so they are responsible for the rotation of the torso. You cannot use them. So the muscles which are aiming diagonally upwards, which are responsible for the rotation of the pelvis and so on, your child cannot use them. And then the deepest transversus abdominis, so these are the muscles responsible for the real stability of the torso, the child cannot use them. And then as a result you have all these typical troubles. The child just uses, like when trying to use the muscles of the legs and the muscles of the abdomen or the muscles of the chest, everything becomes one big fusion, and then you have a whole lot of troubles which are coming out from that. Because you have no way to get this independent movement if the muscles of the abdominal are glued together. But you can see how tight is the entire abdominal and the chest wall, and how they are not divided from each other in this case. And then there's another set of pictures which is showing you that yes, indeed, the abdominal wall layers and the chest wall layers are continuous. So this you can see here. So that's kind of a technical term, anterolateral surface of the abdomen and that anterolateral surface of the chest. But what you can see here, the same type of the layers, they continue throughout, and they're influencing both the respiration and the digestion. So here you can see the names, right? So external oblique muscle, internal oblique muscle. So these are the ones which are intersecting. So therefore, the child finds himself in this unfortunate situation that mobility is lost. And that's what we really need to get. And in order to restore this mobility, we really need to dig in and unlock the properties of the scar. And then for this understanding, how does the scar work? Our classic reference, really the genius movie of Jean-Claude Gubertot, The Strolling Out of the Skin, that's very, very helpful, because it really shows us both the matter and the model of how this under skin to muscle layers work, and what exactly would be happening there in the scarring situation. So here in this video you can really see how it's working. So what's happening there are actually shuffling and shifting in the mesh which is linked to the skin. So, and what is the scar? The scar is the one that pretty much brings the fusion and gluing to this entire mesh, so that fine superstructure or infrastructure of the adjustable micro compartments, which gives the flexibility and the control at the same time, so this one gets lost. So that's really is the challenge. And what do you want? We want to rebuild this original infrastructure. We want to restore and find the way how this deeper layers themselves, which are looking like this fine mesh, how they're going to find their way through and would reintegrate majority of the scar, so that we would have the restoration of this ability to shift, the respective shift between the layers. So that's really what we are looking for in this entire scenario. So, and these are the dynamics which are being lost, and these are the dynamics that we're looking to recover. So that's the essence. So you can really visualize, okay, if these dynamics are lost, so this is the same way that the dynamics would be lost between the layers of the abdomen, for example. So all these fusions, and then your child just has this tight knot. So yes, the feeding is more or less solved and improved, but this tight knot is then affecting the entire mechanical development, and then causes all sorts of the effects, the scoliosis, additional troubles with the hip dislocation, and everything else that you are otherwise trying to fight against. But the source of those would lie elsewhere. So the unaddressed scars, that's a huge, massive problem. So that would be the completion of this part 1. And then in part 2, we're going to discuss in a better detail the evolution of the scar in its specifics, so that you'll be able to really kind of concentrate and visualize what essentials should be happening there. And that's what your child actually needs in order to get those extra freedoms and unlock the development of the torso and the legs, and of course including the spine and the pelvis. So when the internal scarring blockage prevents it from developing forwards.